Good morning. I am Dr. PRIYANKA VASHISTH. I did my BHMS from Homoeopathic Medical College, Delhi, and I did my PG in Organon of Medicine from NHMC AGRA. Today, I am here with you to speak on the subject of practice of medicine, how to study practice of medicine. Let's study it by linking it to another subject of homeopathy, that is Organon of Medicine. As taught by the master, the physician's high and only mission is to restore sick to health, that is to cure as it is termed. Now, there are essentially three steps to it. First, there has to be the knowledge of the disease condition, that is the disease diagnosis. Secondly, the knowledge of the medicine. Thirdly, the application of the knowledge of the medicine to the application of the knowledge of disease, so that the cure must ensue. Now, the most basic tool for the disease diagnosis are the signs and symptoms. Okay, the various manifestations from the former healthy state to the now diseased condition. Alright. Now, these are basically the various sensations which are as perceived by the patient himself, or as remarked by the people around them, or as observed by the physician himself. Okay, now all these perceptible signs and symptoms, they represent the disease in its whole extent. They are basically the outwardly reflected picture of the internal essence of the turmoil that is going on in the vital force. Alright? Now, at the times of Hahnemann, the tools which were available to our hand were very limited. That is why he advised us to rely on the basic signs and symptoms and manifestations for the disease diagnosis. Alright. But now, with the advancements in the field of medicine, we have multiple tools and various investigations, laboratory findings, etc. at our hand for the disease diagnosis in its whole extent, in its all manifestations accurately. Alright. Now, but why do we need to diagnose? What is the need to diagnose a particular condition? Okay, what is the use of this practice of medicine? Firstly, we need to understand what are the changes at the organ level or the tissue level. Secondly, to what extent the disease has progressed to. Third, what kind of or what line of treatment is required. Does it require a curative treatment or a palliative one? Then, evaluating the symptoms, we'll be able to find out the most appropriate similia. And lastly, it also helps us in selection of the potency of the medicine. Alright? But the practice of medicine in itself is a very vast subject. How to study practice of medicine is a big question. One of the major problems that I faced myself during my preparation days was how to recall the various topics in the various systems of the medicine. Okay. Now, there are basically two methodologies of study. First, to study system-wise. That is, we move from CNS to CVS to GIT. But the major drawback with this methodology is, by the time we move from CNS to GIT to CVS, we are not able to recall what we studied in CNS. Okay. To recall from this kind of methodology, I devised another methodology, which is the second one, which is the topic-wise study of the subject of practice of medicine. Alright, let me explain it with help of an example. Okay, example. Let's say a patient comes to you with dyspnea. Okay, now someone who studies system-wise will be able to recall only to such an extent that yes, it might be related to respiratory system or it might be related to the CVS system. Okay, now beyond that becomes a great task. Diagnosis is difficult, and secondly, differential diagnosis is far away. Okay. Now, secondly, someone who has done topic-wise study will be able to recall all the topics which has similar signs and symptoms. For example, dyspnea. As we are talking about dyspnea, he'll be able to recall that yes, myocardial infarction, acute myocardial infarction, pleural effusion, pericardial effusion, sarcoidosis, COPDs, pneumonia, all these conditions have similar symptom, that is dyspnea. Now, with the help of further investigations and various other laboratory findings, we'll be able to differentiate between the various disease conditions by means of ECG, by means of X-ray, HRCT, etc. etc. Now, if you are also facing similar problem, then this is the place for you, my friend. Enroll in our UPSC courses for study of practice of medicine, and pass the exams with flying colors. Hope to see you all soon. Thank you.